Talk to me about the 3D printed technology. Is this useful? Is this something that you have used in your own experience?
It's extremely useful for not just for AVM, but for complex aneurysms. Yeah, we have reached the point that we can actually model the exact AVM or the aneurysm of a particular patient,
wow,
and then test different devices, different approach in vitro before you go into the patient. So this is something that we're doing more and more, and the technology is getting easier and easier, more user-friendly, and available in more comprehensive stroke centers. So it is something that is extremely, extremely useful. You can test things before you can actually go in and take care of the problem. So it's fascinating. Like I said before, we're living amazing times.
It is.
It's been extremely rewarding, this patient that were considered to be have a horrible prognosis of death and disabilities, and now they're fine. They go back to a normal life like nothing ever happened.
That's incredible. I want to move on and talk about spinal AVMs and how different that is from brain AVMs.
So spinal AVMs are not that common, thank God, and they're particularly challenging because the spinal cord is an extremely small structure and is extremely sensitive. All the cables that go from the brain to all our muscles go to the spinal cord. So if you make a half a millimeter cut, you can paralyze someone completely. So they're extremely, extremely challenging.